Thanks, Ryan. Well, most of us know about normal physical therapy routines that take place in offices, but have you ever done it in the water? Cumberland Physical Therapy offers aquatic therapy as an alternative to conventional methods. Dr. Jose Dominguez is here to give us some insight on the therapy. Welcome to Good Day PA, sir.
Thank you. Thanks for having me.
Oh, you're welcome. We're glad to have you. So tell me about aquatic therapy. I guess besides just the water part of it, what makes it so different from conventional physical therapy?
Well, when you first walk into the water, the effects of gravity are diminished significantly because of the buoyancy of the water.
Okay.
So patient can move easier, they can walk in and exercise in the water with a lot less pain. So basically, if you're in about to your waist in the pool, about 50% of your body is eliminated. If you're in up to your chest, about 70%, and if you're up to your neck, about 90% of your body weight is eliminated. So it allows people to move a lot easier with a lot less pain. They can work more comfortably than if they're in land, where they may not be able to do that because of pain and stiffness in their joints.
Well, you mentioned the whole being in the water kind of to your waist or all the way up. So does this mean it's not just for the lower body? It can help up here too, up on top?
Yes, the effects of the buoyancy are more helpful for the lower body, but the warmth of the water allows the patients to relax and have a more comfortable therapy session. We keep the pool at about 88 to 92 degrees, which is great. It feels like bath water.
That feels nice.
So it's very comfortable. A lot of our patients don't want to leave the pool after being there for a little while. And so you can do upper body injuries as well because of the relaxation and then increased blood flow that you get to the muscles and joints.
Honestly, it sounds fun too. I mean, I love being in the water, so it seems like a more enjoyable experience. What sort of equipment can you use? Because you're used to seeing people, you know, on treadmills or using weights in physical therapy on dry land, but what happens in the water?
Well, we have all kinds of different pool toys, as we like to call them.
Pool toys, see, fun.
Yeah, they're fun. Yeah, the water itself gives you resistance or assistance to movement depending on how you set up the exercise. But we do have balls and bands and noodles. We have underwater weights. We have dumbbells that we use in the pool. But we also have bikes and underwater treadmills as well.
I'm curious about underwater treadmills. I saw it in some of the pictures, and it looked like the gentleman we saw was sort of running underwater. How does that work? How do you get something like that into the water?
Well, it is neat. This company, HydroWorks, that developed these underwater treadmills that work really well. Patients get in and they can run and walk in the pool. And many times they say that they have a hard time getting around the house or the grocery store because of pain and stiffness in their joints. And when they're in the pool, in the underwater treadmills, they can walk or run for up to 30-40 minutes, and they're amazed that they don't have any pain. So it's extremely helpful.
So if you go through this process and it really, really helps you and you want to continue this, what kind of options are available? If you don't have a pool at home, to do it at home.
Right, we do have an aquatic wellness program, so the patient can continue exercising after they're done with physical therapy. So they can join the facility and they can take classes, they can use the underwater treadmills and bikes, they can do their own program that we set up for them. And the nice thing is that the therapists are still around in case they have any further questions or concerns. We're available to help with that.
Sure, and I know it's important to note that you do not need a doctor's recommendation to come to your facility to do physical therapy. So now's a good time to invite people to come, and you have some offers for us.
Sure. You can just call directly. You don't need a prescription from a doctor. You can just come see us directly. You can call and make an appointment, and it's usually covered by most insurances without a physician's referral. And we'll take a look at you to see if you would be a good candidate for aquatic or regular physical therapy. And we can set you up for an appointment to come in. We do have a couple offers today.
Right.
ABC 27, since you're so kind to have us, the first 27 callers will get a free assessment to see if they would benefit from aquatic or physical therapy.
Wonderful.
And the first 10 callers will get a month-long membership to our facility.
Wow,
so they can
that's incredible.
Use the facility for a month for free.
That is a really generous offer.
Sure.
Well, thank you so much, Doctor, for sharing aquatic therapy with us today. It's very interesting. I'm intrigued.
Thanks for having me.